afternoon. Welcome back and welcome to our modules looking at the impact of trauma on various aspects of health. Today actually I'm going to talk about perinatal health, and particularly I'm going to talk about PTSD related to childbirth. And again, this is an area that a lot of times people who work in the trauma field are unaware of. This is an area sometimes where I think people have kind of neglected. But you'll see actually we really do have actually a rich literature in this field, and it is a very unfortunately common source of trauma within women, or in women. Okay, so first of all, we're going to look at the issue of childbirth, and can it be actually related to post-traumatic stress disorder? Okay, so that's going to be the first question we're going to ask, and the short answer to that is yes, absolutely. And in fact, there's much more I can say about this than I can say in this brief amount of time, but I'm going to make you suggest that you check out a couple of other resources if you want to know more about this. But also we want to talk in this module a little bit about how this might actually impact a woman, both in the short and the long term. And again, like I said, that's, I think, in some ways some of the more distressing stuff that's come out of the research in the last couple of years, is just seeing really, if there's no intervention, how long these effects can go on. Okay, so the question is, how common is post-traumatic stress disorder after childbirth? And I think that that is a really kind of key question. Because again, a lot of times, we tend to think of PTSD in terms of some of the stuff that we know and we've studied for a long time. That we look at it in terms of, combat, natural disaster, sexual assault, the Holocaust, some pretty serious stuff, and we think, well, how could childbirth actually really even come up to that level? Well, let's start by looking at a study that came out in 2011. It was a survey, a national survey in the United States called the Listening to Mothers 2 survey. Done with very good survey methodology, nationally representative sample. And again, like I said, you can see the sample size in here. So they did an online survey, and they also did telephone interviews. They did a follow-up. And what's interesting is 9% met full criteria for PTSD, okay, at the assessment point. And they had 18% scoring above the cutoff for post-traumatic stress symptoms. So not meeting the threshold for PTSD, but still showing a lot of symptoms. And again, like I said, that may not seem like a very big number to you. But the one that I always kind of come back and compare it to is a really interesting study that followed up following September 11th, going down to Lower Manhattan and assessing, the reactions that people were having. And a lot of the studies actually showed that men and women were having serious reactions. A lot of sleep problems, a lot of kind of stress, more substance abuse, more smoking, sleep problems. I mean, there was just a whole series of problems. But when you looked at full criteria of PTSD, it was 7.5%. Okay, now this is the first time that a sample in the U.S. looking at birth has had a number that has exceeded that number. Now, not everybody has found that. Okay, but again, like I said, I think that that's a very disturbing sign, and a lot of us in the childbirth field actually really are feeling that way as well. Okay, now another study in the U.S. didn't find quite as high a rates. You can actually see up here, by the time you hit 12 weeks, the rate was 6.3%, so that is definitely less than 9%. But what's interesting is to take a look at how many of these women describe their birth as being traumatic. Even though they didn't meet the threshold for PTSD, they were actually still using a lot of the same kind of framework. And what you can actually see too is how few of these women really kind of got off the hook, even though they didn't have PTSD. Take a look at these rates, of depression and anxiety. Okay, so very, very high percentages. Okay, so again, this raises the issue of, even though you don't have PTSD necessarily, there's something going on with childbirth that is leading to these rather severe reactions in women, and I don't think people are necessarily hearing this, and I think we need to. So one of my friends who's a midwife, she actually asked me one time, we were talking about this, and she said, well, Kathy, don't you think that, birth is just hard? She said, birth, you're really kind of, walking on that sort of threshold between life and death. It's a big deal. And she said, a lot of my patients tell me, like when they're right in the middle of things, that they think they're going to die. And that is actually going to turn out to be one of the most significant kind of risk factors for it. Does a woman really truly believe that either she is going to die or her baby's going to die? But she said, most of my patients say that. She said, are you saying that they all have PTSD? And I said, well, no. I mean, first of all, if they're still saying that a month out, then I would definitely at least raise that as a possibility. But is it always true that birth always leads to a certain percentage? Well, I think we can actually examine that by looking at some different data from different countries. So for example, let's take a situation where, we have a country that views birth as a normal thing, that, the intervention rates tend to be low, so in terms of there's not a lot of instrumental deliveries, there's not a lot of cesarean sections, and women have continuous labor support through the whole time. Would we expect, given those circumstances, that the rates of women who report PTSD following childbirth are lower? And in fact, that's exactly what we find. You look at a country like Sweden. Now, Scandinavia has always been kind of, one of the places where we look that do a lot of things right in terms of childbirth and postpartum. And you can actually see a prospective study, and really different rates than what we see in the U.S. 1.3% met full criteria for PTSD. So this does definitely suggest that there are always going to be a subgroup of women, that say for example have medical emergencies. I mean, you can't always avoid those, and so PTSD after that, but at a substantially lower rate. And again, the predictors are very similar to what we see here in the U.S., but again with a much lower rate. So some of the psychological factors: depression in early pregnancy, severe fear of childbirth, and stress in later pregnancy. And we see a very similar kind of pattern in the Netherlands. Again, this is another place where women tend to have continuous labor support. Often there's a high percentage of women that give birth at home. And you again see, look at this, 1.2% for full criteria PTSD, and 9% identified the birth as traumatic. Now remember, that was close to 46% for the U.S. sample. Okay, and actually what was interesting is they found that there was no difference between home and hospital delivery if you controlled for complications. And so women who had medical emergencies, who were in tertiary care settings, were 3 times more likely. So 12% reported PTSD compared to 3% for women in sort of normal maternity care. Now you can look at it the other way. What if you have a country where the status of women is generally low? And so we wouldn't necessarily expect that their birth experiences are going to be positive, because if the status in the country is low of women, it's probably going to translate also into the hospital setting. And in fact, you do see that as well. This was a study looking at women in Iran. Okay, and you actually can see, look at this, 20% of the women had full criteria PTSD in the postpartum period. Okay, so more than half were reporting traumatic births. And the risk factors are very similar to what we see here, but again, it gives you an idea that, the place where the woman gives birth does make a difference. Okay, and so again, gestational age of delivery, how many prenatal care visits she had, how many complications, what were her intervals between pregnancies, how quickly did she become pregnant again. Unfortunately, given high rates of partner violence in some of these cultures, pregnancy intervals tend to be pretty short, so that increases the likelihood. But also, how long did her labor go on, and what type of delivery did she have? Okay, so to just give you kind of a little bit of an idea of, the types of things that women say after they have a traumatic delivery. This is one quote from Ayer's study in Great Britain. She said, "I just kept thinking about it all the time. I felt like I had some sort of car crash or something. I kept getting flashbacks all the time, and I found that very upsetting." And again, you hear this kind of language from women when they talk about their births. And so again, it kind of raises the issue of, when people say, well, how can people get PTSD from this? Well, you really need to kind of listen to what the women are saying. And when they use some of the language that they're using, it really does indicate that, what's picking up on the assessment measures of PTSD really actually reflects their reality. I remember one time talking to a mother. I met her actually at a conference in Northern California, and she had actually been visiting Israel and was in a terrorist attack. Somebody had thrown a grenade into the bus she was riding in. And she ended up actually quite seriously injured in the hospital. Well, eventually she got better. She came home, she married, she had a baby. Very difficult delivery. And the thing that she came up and told me about, which I thought was really interesting, because she said, that, just in the talk we did about talking about post-traumatic stress disorder, that it explained it to her. She said, after she had that very difficult delivery, one of the things that happened is every time she shut her eyes, she kept seeing shattering glass. And what had happened, and had made no sense to her up until we, had this conversation, was that it was reactivating. Her birth had kind of reactivated that previous trauma. And again, so it's interesting the language that women use. This was actually another one. This was actually from Cheryl Beck's research on this, and she's done a lot of the good qualitative research on this. But she said, this one mom said, "I had flashbacks to the birth every time I would feed him. When he was put on me in the hospital, he wasn't breathing and he was blue. I kept picturing this, and I could still feel what it was like. Breastfeeding him was a similar position as to the way he was put on me." And when I train providers about this, this is one thing I kind of always say is, I'm sure the providers were actually quite oblivious to this reaction that this mother was having, that they really probably had no idea. And yet, here this mother had, obviously had severe fear that her baby was dying, that something was severely wrong. Then she was having kind of flashbacks to that when they were trying to put this baby on to breastfeed. And again, like I said, I really suspect that the providers actually had no idea. And it's one of the things I often tell providers too. It's like, watch for some of the subtle things. Watch for a mother that kind of shuts down. Watch for a mother who recoils when you put the baby on her. These could be kind of clues. Now, one other thing that I think actually is a really rather disturbing finding is this, again, from the Listening to Mothers 2 survey, is to take a look at some of the ethnic group differences. And again, I said, I really think that we have yet to really explore these. And I think actually, again, I think they've got some really important implications. Now remember, with Listening to Mothers 2, 18% of the sample had post-traumatic stress symptoms. But when you looked by ethnic group, take a look at African American mothers, 26% reported this. Okay, compared to 14% of Hispanic mothers. Okay, so what is going on with that? And to be honest with you, I don't really know. But again, considering, this is a group, where we're concerned about high rates of infant mortality, we got to kind of wonder what's going on here. And so again, I think it's one of the things we need to kind of be looking at. It was interesting, I heard the lead author of this actually speak on this at a conference this year. And one of the things he was saying is, one of the questions they asked, they just did the Listening to Mothers 3 survey, and they asked mothers, would you be more likely after this birth to have a home birth for your next one? Okay, now the percentage of home births in the United States is, right around 1%. Okay, so it's low percentage. What was interesting is it was the African American mothers who had the highest percentage of saying that they would have a home birth next time. Now that's actually really surprising because, demographically speaking, in the United States, it tends to be predominantly Caucasians who have home births. And so again, I said, I really think that there's something going on that we haven't really examined yet, but I think it raises some important issues. And just one other thing I kind of wanted to show you. This I thought was kind of an interesting study. This was a little case study. We of course have big literatures on some of the things that help to treat trauma. But I thought this one was actually, again, just suggestive, not necessarily we base a lot of policy on this. But I thought this was kind of fascinating. It was a case study of 3 women who had a high degree of trauma following a first birth. And they did EMDR during their second pregnancy. And what was interesting is they said, first of all, it reduced the symptoms, the post-traumatic stress symptoms in the mothers, but that they were all more confident and were likely to attempt a vaginal birth the next time around. And I think actually that's a really important thing too, because I think actually birth trauma accounts for a fair number of elective C-sections. Because again, it's like oftentimes women who go through very difficult births, and especially if it ends up in a cesarean, oftentimes they can't face being in that situation again, and so they end up with an elective cesarean. And so again, I think that's kind of an important kind of consideration, and it just shows a treatment that we know that works actually quite well for trauma. Really had some relevance here. Okay, with that actually I'm going to wrap up. I do want to mention this journal here. This is the Journal of the U.S. Lactation Consultant Association. I actually edit this. But if you're interested in birth trauma, I actually have a couple of articles, and these are open access, so they're available at this website. And they are in issue 5.3. So 2 articles on birth trauma. There's some stories. I go into a lot more detail with some of the stories and some of the criteria for PTSD. So I'd encourage you to take a look at that. And I actually, again, want to let you know about my websites. The Uppity Science Chick has a lot of my psychoneuroimmunology and trauma and health. And breastfeedingmadesimple.com has a lot of my information, especially for mothers, about things like overcoming birth trauma, and especially if you've got PTSD and you've got somebody who you're working with, or somebody, if it's you yourself, and you want to know more about trauma and how it can impact you, and what are some things you can kind of do to heal and get better, that would be the place to go. So thank you for tuning in, and I'll see you next time.